lot of mothers ask me, what do I do if my daughter feels like she is fat and she's really skinny? A lot of mothers wonder what to do when their otherwise very skinny daughter complains about being too fat. They get alarmed that they have a problem with an eating disorder at a young age. Let's talk about this a little bit. One of the most useful things you can do if your daughter complains that she's fat is not to immediately disagree with her. Don't argue. Don't immediately say, "No, you're not." Ask her what makes her think she's fat. Ask her if she can help you explain or help you learn what part of her body looks fat to her. It may be her thighs, it may be her stomach, it may be her upper arms, but ask her carefully why she feels that it looks heavy. Sometimes taking the comment very seriously and talking about the muscles she has in her thighs and why her muscles actually make her legs look bigger than they did 3 weeks ago because she's been running or because she's been riding a bike, or talking about the muscles in her upper arms, or talking about the normal shape of how a stomach should look. Sometimes actually paying attention to what she's looking at and seeing if you can understand it from her perspective is much more helpful than immediately arguing. If you and your daughter have already had a lot of conversations about why she feels that she is fat, then let her know that you would like her to get feedback from an expert. Readily admit that mothers are not experts in the health and appearance of their daughters, but you want her to seek expert opinions because knowing whether or not you're a healthy weight is an important part of taking care of yourself. Don't leave her an option. Make sure that you bring this up in a non-judgmental manner when she's at the pediatrician's office. It might start with something like, "We were both wondering what a healthy weight might be for my daughter at this age, and whether or not you're concerned that she's either too thin or too heavy, and if you could give us some feedback about that." Don't give away her own feelings and risk mortifying her about that until you've taken this preliminary step. If you've already talked to a pediatrician and she has heard a lot of objective feedback that she is very healthy or underweight, then pay a lot of attention to her behavior. Monitor and see if she is exercising too much, if she seems to be hyper-restricting certain foods, if she seems to be very preoccupied with calories. These are important warning signs that a concern about being too heavy is getting into a range or an area that may be problematic. If you see these behaviors over time, it tells you that it is high time to consult a mental health expert. You may ask your pediatrician for a referral, but you want to see someone who specializes in helping young girls with eating disorders or eating concerns. I'm Dr. Laurie Williams. If you found this helpful, please visit my website at raisingdaughterstoday.com.